Hello, my name is Dr. Aashish Contractor and I am a preventive cardiology and rehabilitation specialist. A question that I'm often asked is how do you prevent yourself or how do I prevent myself from having a heart attack? So let's take a step back. To prevent anything from happening, you first need to know what causes it. So the causative factors or what we call risk factors for a heart attack are well defined and well understood. They fall into two categories: risk factors which you cannot change and those which you can. So the ones you cannot change, let's talk about them first. The first one is age. Unfortunately, age is a one-way street. So as you grow older, your risk not only for heart disease but stroke, cancer, diabetes, etc. goes up. The second is family history. So if someone in your family, especially your immediate family, which is your mother, father, brother, sister, has heart disease, your risk goes up. It does not mean that if they've suffered, you have to have a problem. It just means that your risk goes up compared to somebody who's not suffered. And the third factor is your gender. So men typically tend to have heart disease at a younger age than women because women are thought to be protected until menopause. After menopause, unfortunately, it's an equal opportunity killer and men and women die equally of heart disease. So these are risk factors which you cannot change. The risk factors which you can change. So the first four most important ones would be smoking and tobacco use. Now this is one condition where we don't talk about moderation. If you smoke, if you take tobacco, the goal is to try and quit completely. It's not a question of moderation. It's not that if you are having 10 cigarettes first, now can you have 3? Is that okay? No. I joke with people that when patients ask me that question, I answer by saying, if you're going to jump off a building, should I jump from the 10th floor or the 5th floor? Yes, you probably are better off jumping from the 5th floor, but you'll anyway still die, right? So smoking has got to be 0. The second one is high blood pressure. Normal blood pressure is less than 120 over 80 millimeters of mercury. Between 120 and 140 is what we call borderline blood pressure. Between 80 and 90 is what we call borderline blood pressure. When it crosses 140 on the upper number or 90 on the lower number, that's when we call it hypertension. So hypertension is a very important risk factor for both heart disease as well as stroke. The third is diabetes. Today, unfortunately, India is considered the diabetes capital of the world. And those with diabetes, you have to take the same care as if the person's already had heart disease, especially in women. Diabetes in women is more deadly than diabetes in men. So here your fasting sugar should ideally be less than 100. Between 100 and 125 is a borderline zone. And when it's more than 126 fasting, that's considered diabetic. Now remember to check your sugar at least on 2 occasions. Just one off high reading, don't get worried about it. The fourth is cholesterol. In that we have something called a lipid profile. Most of you have done your cholesterol values and you've got 4 numbers: your total cholesterol, your triglycerides, your HDL and your LDL. So your total cholesterol should be less than 200. The triglycerides, which is the fat in the bloodstream, should be less than 150. HDL, which is the good cholesterol. People always get confused, which is good, which is bad. I tell them, remember, H is healthy, so higher the better. It should be more than 40. And L is lousy, so the lower the better. So your bad cholesterol should be ideally less than 100 milligrams per deciliter. So these are the 4 biggest ones: smoking, high blood pressure, diabetes and cholesterol. The others are physical inactivity, not doing exercise at least for 30 minutes, 3 days a week, overweight, your body mass index being more than 25, or being obese, your body mass index being more than 30, and stress. Now stress is the one risk factor which we cannot measure. I can tell you that your blood pressure is 120 by 80 or your cholesterol is 200 or 210, but there's no number for stress. Stress is something we all live with on a daily life, and all of you are high achievers, so stress is definitely a part of your life. But when stress becomes distress, that's a problem. If you find that because of stress you're not sleeping adequately, you're changing your lifestyle habits, then stress can have both a direct and an indirect effect on your heart. So if we take care of these risk factors that I just spoke to you about, you're going to greatly reduce your chance of having a heart attack. Please remember, there's no guarantee. So just because you take care of everything doesn't mean you can't have a problem. It's like saying when you drive a car. When we drive a car, we drive carefully. We make sure the brakes are okay. We make sure we're not speeding. We make sure we're not talking on the phone. But that doesn't mean someone can't come and hit you from behind. So all of you know somebody who leads a perfect life and still had a problem, and all of you know that one friend who's done everything wrong and still has not had a problem. But those are honestly 5% on either side. Most of you, if you take care, won't have a problem, and if you don't take care, unfortunately you will. So make sure you keep your heart disease risk factors to a minimum, and that's the best way to prevent yourself from having a heart attack.